Hi, my name's John Hannon. I'm the author of the book Your Normal Mind. By now, I hope you've had a look at the prior exercise and done that at least a few times. In this follow up exercise, we will build on the skills in the first exercise and learn how to manage difficult internal sensations. Don't worry, it won't be too uncomfortable and you can stop at any time. This exercise is from acceptance and commitment therapy, and what we will do is stop swallowing, as in not even swallow saliva. That's going to generate a little bit of an uncomfortable sensation. I'll let you know when to start that. For now, keep swallowing. When we do stop swallowing, we're going to get curious about the nature of the urge to swallow. The sensation that is the urge to swallow is another of those objects in consciousness. We'll have a closer look at that and practice approaching uncomfortable sensation in a different way. So let's get started. Sit comfortably with your eyes closed if you're happy to. And just a reminder of the prior exercise. Take your awareness down to your left foot. Take your awareness to your left knee. Notice that part of you that moves around when you do that. Take your awareness to your vision. So even with your eyes closed, it looks like you're looking at the colours you can see through your eyes. And that's different to when we generate a random visual image. So generate a random visual image as we did in the previous exercise. Get curious about where this visual image came from. It wasn't there in conscious experience a moment ago. So where did it come from? And where does it sit now? It's in the universe somewhere because you're aware of it. But where exactly in the geographical space of the universe does it sit? And also notice that this image can't step outside of you and take any action in the real world. An uncomfortable sensation is the same. It exists in this space of consciousness and it can't step outside of you and take any action in the real world. So now take your awareness to your tongue and your mouth. Maybe there's a sensation of leftover flavour on the top and sides of your tongue. Now move your awareness down to the base of your tongue, where it attaches to the floor of your mouth. Here, there's a little bit of sensation that, as the urge gets stronger, it becomes the urge to swallow. So now is the time that I'll get you to stop swallowing. Notice any anxiety that comes with that moment. Acknowledge that anxiety and be willing to let it be there for a little while. Now take your awareness to the sensation that is the urge to swallow. We're going to get curious about the sensation of the urge to swallow. Imagine you're a curious scientist who wants to know everything you can about this sensation. Or you could imagine being a curious young child who stumbles across a lady beetle in the garden for the first time ever, and turning it over, finding out everything you can about it. So most of the time your habit is to get rid of unpleasant sensations. That's the function of this urge to swallow. It makes you swallow so that the sensation goes away. And in that way, your subconscious directs your behavior. But there's nothing that says you have to respond to this urge in this particular moment. You can take your awareness towards this sensation rather than try to distract yourself away from it. So again, take your awareness down to the base of the tongue or in the gills wherever you feel this urge. Notice what kind of sensation the urge to swallow is. So objects in consciousness are the pressure on the skin, images in the mind, vision, and this urge to swallow is just one more experience, one more piece of content in consciousness. Let's get curious about it. The first thing to notice is that it must have a shape in there. It's in there somewhere, but it's hard to pinpoint. We talked about pinpointing things that are in consciousness. Where exactly are they in the universe? This is a little bit tricky, but nonetheless, this urge, this object, it's not in the tip of your nose. It's not in the tips of your ears, and probably not the top of your head, and it's not in the base of your spine. But it's somewhere in between. So it must have a shape. See if you can find out what shape it is. Some people find the following instruction helpful, whatever this means for you. As you breathe in through your nose, follow the air as it moves down the back of your throat and kind of wash it over the shape. See if that helps you define the shape of this object in consciousness. Now, if the object has a shape, it must have a surface. So what is the surface like? Is it dry? Is it rough or smooth or shiny? Are the edges a soft, fuzzy energy? What is that surface like? Again, use the air as it washes down the back of your throat. See if you can help make sense of this shape. What consistency is the shape? Is it solid, liquid, gas, again, a fuzzy ball of energy? Is it putty, jelly? Does the shape have a colour? If it has colour, is it solid colour or can you see through it, again, like jelly or liquid or gas? All the while we're doing this, just remember you've got that little flashlight, that bit of attention and awareness. When you get distracted, just bring it back to the sensation. So whatever this sensation is, or the shape, or the urge to swallow, notice how the urge comes and goes in strength. Sometimes it's stronger and then it subsides, comes and goes in waves of intensity. In fact, we even have a saying, surfing the urges. Notice how nothing bad is happening to you as you allow that sensation to be there. To some degree, that sensation is not real. It's just an object created in your conscious experience. So what else can we find out about it? Does the object have a temperature? Is it ice cold, burning hot, body temperature, something else? Does the object weigh anything? Does it feel light, heavy, somewhere in between? Notice again how the intensity comes and goes in waves. It's possible to just ride them out. This is unpleasant sensation, and yet when you choose to, you can act in a considered way. You can decide to allow that sensation to just be there and choose not to swallow. In spite of any sensations and emotions, you can always choose your actions. So we are shortly going to do a couple of those deep breaths that we did at the end of the last exercise. Breathing into the diaphragm, then the middle, and then the chest, and then emptying the lungs in the reverse order. I'll give you specific instructions on when to start them after we talk about what to think about while you do them. As you do these breaths, and again, whatever this means to you, you're going to use these really deep breaths to expand the area around the shape. You're not trying to get rid of this shape, whatever this urge to swallow is. What we're going to do is expand the space around this object so that you've got plenty of space there. Just being willing to have that experience in there. Remember, this shape, just like the visual image, it can't step outside of you. It can't take action in the world. It can't make you do anything. No one else can see it. It is experience generated by your consciousness to try and make you behave in a certain way. In this case, to swallow. When you do these breaths, sometimes the shape can disappear a little bit. It's important that you don't make the object of this exercise to make the shape go away. The point of this exercise is the willingness to experience the sensation. It's not a way to make it go away.